I'm Peggy Peck, MedPage Today, and I'm here in San Diego at the American Stroke Association meeting, which kicks off tomorrow. I'm discussing this year's meeting with Dr. Patricia Hurn, who is chairing this year's meeting, and she's the first woman to chair the meeting, and Dr. Morgenstern. And let's talk a little bit about, there's some differences this year. I understand there's some new players that are going to be with us this year. Dr. Hurn, could you tell us a little bit about that?
Well, I think the International Stroke Conference is more and more becoming a meeting of partners. And so in addition to our traditional neurology group, which is of course the big strength of this meeting, we also have this year for the first time emergency medicine physicians and nurses, which is a new partnership for us and one we hope really lasts for years. This is also the second year that we have with us the neurosurgical group and the Society of Interventional Neuroradiologists. So this is a very broad perspective of different partners. The meeting is right now full of the nursing, stroke nursing conference, which is probably in its 4th year running, and really a very large addition. So we have all the players here that's involved in every aspect of stroke care. Mm-hmm.
And Dr. Morgenstern, this is sort of a model of the way stroke treatment occurs, that it's a team approach. So you have many disciplines that come together, isn't that correct?
Absolutely. Stroke is very much of a team concept from the time the patient hits the emergency department through seeing neurologists, interventional radiologists. Nursing is a critical part of it, both in the emergency department and the stroke unit. So really we need to have all the players here to really be a comprehensive stroke conference, which we are.
So Dr. Morgenstern, I understand too that we're going to be hearing some science that looks at this, the issue of the stroke bug, if you will. And we've looked at infectious pathways in a number of illnesses and a number of acute events, certainly looked at in cardiovascular disease. What can you tell me? What are we going to be hearing about stroke bug here?
I think for the past couple of years there's been more and more interest in the relationship of infection and inflammation in promoting atherosclerosis, and also part of what happens when somebody has a stroke, and dealing with that infection, trying to reduce inflammation may actually go very far in promoting healing.
Mm-hmm. And Dr. Hurn, it's my understanding that you're the first woman to chair this meeting.
That's correct.
And when I looked at the program, throughout the program, there are a number of gender studies, gender-based studies. So is that related to the fact that there's a woman chairing it, or is this really what we're seeing in terms of the evolving stroke science?
And it's really an excellent question. I'd say it has absolutely nothing to do with being the first woman's chair. In actuality, it's sort of that the science has started to come to a real important point, that we understand clinically that women may present differently with stroke and have different responses to treatments of stroke. And so there's really going to be some very novel information coming from this meeting, looking very strongly at that. For quite some time, there's been some interest if there'd be differences between men and women's response to TPA, the one drug that we have that really is our upfront treatment to be able to move stroke forward. And it is currently in debate, but that's exactly the kind of science that we're going to see at this meeting, is focusing on potential differences and really what they mean for practice.
And that gender difference in TPA is actually the subject of a presentation that will be a simultaneous publication in the journal Stroke.
Correct.
Is that correct?
That is correct also.
That's right.
Mm-hmm. And you have, it looks to me like you have a bumper crop of those simultaneous publications, and I counted more than 6.
Well, I think that's an important function of the meeting, is to be able to put that out to the community, that what is here and at the same time is out there for everyone to be able to have access to. Mm-hmm. But absolutely the big piece of this meeting is cutting edge science, first time out there for people to see.
Okay, and in terms of that first look, we're going to see some high-tech stroke treatments here as well. Dr. Morgenstern, why don't you just give us a little hint about what we'll be seeing later in the week?
Well, we mentioned just a little while ago about the use of TPA or a thrombolytic to treat stroke, and we have done that mostly by intravenous access. There's more and more interest in doing it intra-arterial, having direct catheter approaches, not only with thrombolytics but mechanical devices. And at this meeting there will be a lot of discussion about that, with all sorts of newfangled treatments, including lasers, special catheters, and various combined approaches of lytics and mechanical devices as well.
And as I understand, another new feature, if you will, at this year's meeting will be a series of sessions that are ethical debates. I find this very intriguing. Perhaps you can tell me a little more.
Well, one of the things that's been a real strong point of the ISC is that we wanted to involve people to dialogue as well as just to sit and to receive new information. So this year we have a series of forums and pro-con debates. But one of the ones I think is most interesting is the pro-con debate on ethical issues in stroke. For example, what if there are agents which are unproven but in fact are approved for use? Should they, pro or con, be used in practice? What about drugs that are off-label? Pro or con, should these be employed for the treatment of stroke? So that's one of the several sessions I think is going to be extremely exciting and very spirited.
Oh, really?
Oh, there will be many views on the pros and the cons, without a doubt.
Would you agree, Dr. Morgenstern?
I would agree. As a clinician, I think we encounter these ethical decisions every day. What do we do with new treatments before they are met with guidelines support? What do we do with treatments that we think work but have not been studied adequately? These are real-world issues that clinicians deal with every day, and I think that we're going to see lots of interesting discussion about it.
So lots of discussion, lots of science and emerging science that we can expect to see over the next few days here at the American Stroke Association's International Stroke Conference. I'm Peggy Peck, MedPage Today.